Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Arnavaz. She's CEO and co-founder at Zirr AI, and Dr. Ali Daneshmand. He's co-founder at Zirr AI. Welcome.
Hi there. Thanks for having me.
Hello, thanks for having me.
Yeah, and this is part of our ongoing series of interviews with the leading ambient clinical voice companies, medical scribes, however you want to call them, these AI medical scribes. We're excited to have you here. And Ali, maybe you want to kick us off? Tell us a little bit about yourself and Zirr AI.
Sure, my name is Ali Daneshmand. I'm a neurologist by training, and I'm one of the co-founders of the Zirr AI Medical Scribe, and we can talk about it more, I guess, during the whole interview.
Yeah, we'll definitely be diving into more. Arnavaz, tell us a little bit about yourself as well.
I'm Arnavaz Hajizadeh Barfejani. I'm pharmacist by training, and I worked for a couple of years, went back to medical school, and recently graduated from medical school.
Wow.
And I'm the co-founder and CEO of Zirr AI. This is something that we are very passionate about as a couple because we firsthand experienced the struggles of writing notes. And that's why we came up with this idea.
Yeah, that's awesome. I mean, a little bit of an overachiever, pharmacist and a MD. That's that's pretty impressive, but it is a big problem. So we're excited about it as well. Maybe tell us, how did the Zirr AI start? It's interesting that you both have that problem as doctors and you wanted to solve it. Is that what led to it, or is there more to the background of the story?
I think Ali would love to talk about that more because he's been in practice way more than me.
Yeah, so basically the idea, I mean, I've heard about the, medical AI scribes and all of that a little bit, and I actually looked online, tried to use a few of them, and this is back, I would say around 1.5, 2 years ago. And one of the things I noticed is that they do not really address certain things that I'm looking for in a medical AI scribe. To be user friendly, to capture the speech well, to come up with what I'm looking for in terms of the note that I'm writing. And I'm no sort of business person at all. I'm medical background. I studied my whole life basically. And I was thinking, okay, well, this is good, but this is not really what I'm looking for. So I was like, how about if we come up with something from our own side and try to build it on our own way? And that's I talked to Arnavaz about it, and she was like, "Yeah, we can do that." And she's a bit more tech savvy than I am. She knows more about ins and outs of doing things like this, and she also has better connections, friends that are co-founders that are on the AI side of the thing. So that's how I was started. I mean, it's basically the need of having something to save the redundant part of our job, the part of that's very important, documentation and note writing. And there is a lot of concerns among physicians about accuracy of note writing, efficiency of note writing. And, there is also this concern on background of a lot of people's minds about the litigation, how accurate our notes are. How are we saving the information that patients provide to us during their encounters? Are we missing something? Um, One of the things that people get worried about is that, okay, I write a note, I use a template, let's say. A lot of people use templates. And a lot of these templates, are essentially in certain format and doesn't capture actually the real interaction with the patients. Like you just click buttons. You say, okay, have this, doesn't have this, which is great, time saving, but then it's kind of copy paste, and sometimes it's goes over and over and over, you see that a lot of information may not be super accurate. People just click buttons just to click it. And that's basically the idea of the AI Scribe. I'll let Arnavaz to chime in more, because then I'm going to go on, and I want to answer more questions as well.
Definitely, Arnavaz, chime in, your perspective on the story, but also, let's talk about some of the differentiators of your solution compared to, I mean, there's a long list. Go check it out at Healthcare IT Today on the right side, Ambient Clinical Voice Companies, but they can go check it out. What's your differentiator at Zirr AI?
I think one of the things I would say about our product that I haven't seen on other product is the fact that we're trying to incorporate something that we call clinical decision support system. What that implies is that, based on the encounter that you have with the patients, our OpenAI algorithm tries to come up with a differential diagnosis and workup sort of steps and plan. Disclaimer, obviously, this is not going to replace the clinician's judgment. This is just something as a background. So if, sometimes you see a patient and you wonder, am I missing something? Is there anything else? And we are hoping that this is going to help. You open up something. Sometimes I, as a doctor, I'm sure, I don't know if Anna was it, I a lot of times Google things. Like, I'm like, oh, let me look at this up. Let me see if this is, well, we trying to incorporate that part in our product. So we have a list of the differentials. We have sort of basic workup plan, and that's where I think our product is definitely different from other products. Again, the softwares that we are using as well are probably a better, I can go about it. We use Amazon Web Services. We use DeepGram. These are the best in speech recognition, in cloud storage, and all of that. I'm not sure about exact softwares that other companies use, but I think that's the other thing I want to emphasize, that it's a bit different.
Interesting. Arnavaz, what would you add to this and this background story of coming together?
Yeah, going back to writing notes, myself as a medical student, I've been trained in Ireland, and over there, most of the hospitals, they are still, we use handwritten notes.
Okay.
And it's completely different than the States, that most hospitals now implement some sort of like electronic medical record. So while I was doing my away rotations as a medical student at different hospitals, that was something that I struggled with a lot, because writing notes is a big part of your job as a student. So let's say in each rotation, depending on what kind of rotation you're doing, I was expected to have at least 4 or 5 patients. And instead of like spending, I don't know, 5 hours just being with those patients, talking with them, being there for them, and learning more, I was spending time to write those notes, because that was a huge part of expectation for me as a student. And I honestly think lots of students, when you are still a student, you need to work as much and learn as much as possible, rather than just writing notes and try to get better at them. Because what makes you a better doctor? When like you can sit and chat with your patient, you can hear them out, you can talk to the family, rather than just like being worried, oh my God, that I have one note and the resident is waiting for that note, so I have to go and update that. Sorry, I don't have time for you. So all of this, we kept chatting with each other, and obviously with our CTO, with our great CTO, who is not here today, busy running the business behind the scenes. And we decided to, make it happen.
That's cool. I mean, it's so fascinating. You mean hours writing notes doesn't help a med student educate themselves, or or stressing that they forgot to add something to the note that they should have added? Those are
Exactly.
interesting challenges. So talk to us about, what does the workflow look like? And maybe Arnavaz, you could start out. What does the workflow look like for a clinician? Are you opening it up on a cell phone, or do you have a web-based interface? Talk to us about the workflow for a clinician that uses Zirr AI.
So as of now, we are just still web-based, and we are going to have some sort of software sometime soon, but we are still, at early stages. So the best way is they just open Zirr AI and they type a new patient, and Zirr AI just listens to them. And after they finish the conversation, rather than the physician being worried the entire time, typing out notes and not paying enough attention to the patient, the note is ready by the end of the session. And well, the most important thing, that doesn't affect the rapport that the patient or the physician will have with her or his patient. And second, they won't forget anything important, because you see tons of patients in a day, depending on which area or field you're working. If you're at a clinic or working as a nurse practitioner, your workload is crazy. You see tons of patients. You forget things. A lot of patients have so many similarities, but then there is one thing that makes them different from the other patient. So you don't want to miss that. And Zirr is helpful. That's where Zirr works best, because then you're not missing that very tiny little important thing.
Yeah. Ali, what would you add? And, maybe take it another step further as far as, how much of this is automated with technology? Are there humans in the background? There's a lot in the space that are doing hybrid, and although most are moving to all technology, but where are you guys at in this journey?
Right. Yeah, absolutely. One other thing I want to add is that I think we are web-based, but our website, we have a mobile version on the web. So you can actually open your cell phone and log in and do. I think what Arnavaz was emphasizing, we still don't have an app, which I think it's going to
Right.
be our next stage, that
Correct.
you install an app and just have the app. I think from our standpoint, everything is automatic. It's AI based. There's no human in the background. So the basically what is being the conversation is being listened. It's encrypted, so it's HIPAA compliant. It's uploaded to cloud, and then it's transcribed. And the good thing is that we have the option of having the transcription by seconds and minutes. So anything that the conversation happens is actually transcribed by seconds and minutes. And then you have the SOAP note on a separate tab that you can actually copy paste. You can also edit both of these things. I mean, if you want certain sentences exactly to be there, you can just copy paste from your transcription, put it on your note. Most of the time, when I'm using it, never you need to do that. You just copy paste your SOAP note. And if you want to edit the SOAP note, you can edit it on the web page, or if you want, you can edit it on your EMR documentation, wherever you want. But it's fully automated. We also have a Spanish version. So we have English and Spanish. So if a doctor is fluent in Spanish and want to do it in Spanish, it's translated to English. So you can have a full conversation in Spanish with your patient or via interpreter, and you have a SOAP note on English translated. Once you sign up for this, you go to the website, you sign up. No credit card, nothing is needed. You just enter your info. And that's one of the differences we have with some other website, because a lot of them say, oh, you have to enter your information, but then you have to cancel. And if you don't cancel on time, then you get charged and all of that.
Yeah, no hidden charges.
Yeah. So basically, and then you have basically you gain 12 free sessions. And then if you like it, I hope everybody gonna like it, then you can sign it up for it, and then you can have monthly basically subscription for it, which is less than a cup of coffee a day. So I think from
For sure.
from cost standpoint, we also
I mean, I would know the
are
amount of time I spent, I mean, money I spent on coffee.
yeah.
In order
I
to
could have
stay up
easily
doing
bought a car
notes,
with
that's
that.
the cost. The cost is the
Yeah,
amount of
exactly.
coffee, amount you spend on coffee,
Yeah,
doing notes during pajama time, as they call it.
Yeah.
yeah.
That's interesting. How about when it comes to EHR integration? Are you integrating with the EHRs? Does it work with all EHRs? How are you approaching, that EHR integration element?
Arnavaz, do you want to chime in, or you want me
Go
go
ahead.
with this one?
Go
Okay,
ahead.
okay. So I think at this point, we are basically holding off on going into, because we have to have, financial discussion with these companies, the EHRs for the plugins. But right now, it's essentially a Word document, right? So you can, a lot of people, when they see patients, they write in a Word document or whatever. So you can just copy paste that to your EHR in the hospital or clinic or wherever you work. The goal is eventually to have plugins made for different EHRs, so you can directly use it from your EHR as well. We are
Gotcha.
not that stage yet, I would say.
Still very
Yeah.
early stages.
Yeah, absolutely. And talk to us about the clinician's approach, and do they have to change what they're doing? Ali, you've obviously been practicing for a while. You understand this. So, I mean, a kind of twofold question. Do you have to change how they're talking in the exam room for Zirr AI to be effective? And also, like what is your training onboarding process for them to start using Zirr AI? Is there one, or is it more use it and it's just simple enough they can use it?
We have just recently uploaded a video on the website about how to sign up and use it. So it's very intuitive and very user friendly. There is really no onboarding. You sign up for it, you open you go to the website, you click, you choose your patient, as Arnavaz was saying, and start recording, and that's it. So there is no complexities. And bear in mind, the other thing I want to mention, you asked about the differences. I'm not familiar with all the companies out there, but one of the things is that there's a lot of these companies have physicians as advisors. This company is built by physicians. So we come from the side of the need to come up with this idea. And a lot of things that happens real time in the practice, we see it, and we try to incorporate that needs that come up with by our colleagues or friends, and say, hey, we want to incorporate that in our system as soon as possible. We're like, okay, well, that's a good idea. Let's try to modify that, and sort of, I think that's the other thing, that we don't have that lag that an advisor should tell us what should we do, and then we incorporate that on our website.
Yeah. Arnavaz, anything else you'd add? I mean, certainly in our series, we've heard you have to articulate things you're thinking because the AI can't read your mind unless you guys have that nice feature added on. Neuralink from Elon hasn't happened yet. But any other things you'd suggest for, using this and making sure that it's effective for doctors that are using it?
I think, I mean, as Ali mentioned, this is a very simple platform to use and implementing your daily, patient encounters. But like every other electronic that's out there and needs improvement, the more we use it, the more we would know what are our weaknesses, and we can fix those gaps. And that's about it.
Yeah. Aaliyah, you talked about at the beginning, one of the differentiators that was important to you, and the reason you founded the company, it sounds like, was the other ones weren't accurate enough, right? They didn't represent the clinical, what you needed as a clinician to be able to do this effectively, because if it's wrong, that's liability on you. And I mean, it seems like that's going to be the case. The doctors are going to be the ones liable. So talk to us about how you look at accuracy of the solution. How do you evaluate how accurate Zirr AI is? Modifications that need to be done. I've talked to a lot, obviously. Some do it based on voice recognition, and then on clinical insights, and then on note generation. How do you think about kind of this accuracy of the solution and measuring it?
One of the things that we are relying a lot on these early stages is that we getting feedback from the customers that are using it and try to incorporate that on our algorithms. One of the other things that we are doing is that when we implement it in a clinic, we do a sort of a before after study or survey. So we ask people before using, Zirr AI, how is your experience with note writing? And then structurally, like 1 week after, we do another one. And then we try to get those feedbacks. Like most of the time, we haven't heard anything about accuracy, that it's not accurate because the speech recognition is fairly good. One of the things that I think it's not only, as Anna was mentioning, or you mentioned, I think is not really good, is that some of the, for example, physical examination, when we examine the patient, we don't say it loud, right? So we just examine. So that part, if you don't talk about it, the Zirr AI have no way of figuring out what you actually did. So I think that's one of the parts that people need to edit and enter. And we are having some ideas about how to address that as well. I'm not gonna disclose it here, but that's one of the things that people would say, well, my examination is not fully documented. And we're like, well, there was no conversation, so how it would have been picked up. And I think, that's inherent to the product, actually.
Yep. Arnavaz, how about when it comes to specialties? Does it work across all specialties? Are you focused on certain ones at first? Talk to us about that as far as how it can be used and where it can be used.
I think rather than specialties, mostly we are now focused on clinics,
Okay,
because
so
that's where, yes, because when you are at a clinic, that's where, mostly nurse practitioner or a physician, a resident is just talking all day with those patients, and it's very fast paced, and you see at least 40, 50 patients a day when you are in a clinic, rather than in an inpatient setting, like patient being hospitalized. Most of these patients are very, very sick, so they won't be able to chat through the entire conversation, with you. So we are, as of now, focused in the clinic setting. But we have like inpatient in our mind. We are thinking about incorporating that later on.
Yeah. It's such a different mindset, right? I'm sure all the nurses are saying I want it too, but it's a different problem domain.
I mean, they are great. Like, I can't tell you how many times I reached out to the nurse that I was working with and asked for help, and they are doing 100 things at the same time. And especially nurse practitioners, they are like basically seeing 30 patients in an hour, and they have to go and write those notes, like those 30 patients that they saw. So it's difficult, and I mean, I think they are one of the groups that they're going to benefit from Zirr AI a lot.
Yeah. I mean, it's clearly, you can see from both of you that you know the problem because you've lived it. There's no one watching this will doubt that this comes from a place of genuine need and desire for yourselves and for your colleagues. So that makes a lot of sense. Ali, anything else you'd add?
No, I think as Anna was mentioned, we are aiming for more for general practice right now. And I've seen some companies trying to sub-specialize, like have different templates and everything. I think using a lot of templates would cause the same problem that we have already with EMR, because we have templates in EMR. We don't need Zirr AI or any AI. And I feel like we have to be cognizant that sometimes putting these templates may actually get rid of some of the information, may streamline some other process, but it comes with a cost. And for now, I think our focus is more general and using, obviously the most advanced OpenAI technology, and eventually we may try to tailor it to each subspecialty. That does not mean that a subspecialty cannot use it. And we actually, in neurology, we've tried it. I tried multiple times with different scenarios. And as I mentioned earlier about our clinical decision support system, it's really good. It comes up with very good, accurate differential diagnosis. The more information you provide, the better that differential diagnosis is. So it's not limited to general practice, but it's also the website to be very user friendly. It's streamlined, so you don't have to pick a specialty. You don't have to pick this, that to be able to use it.
Also, I have to add this, having that clinical decision making doesn't mean that we want to get rid of doctors or nurse practitioners or other healthcare providers, not at all. There are times that physicians, let's say they see a patient with pneumonia, 30 of them, 40 of them in a day, and they misdiagnose the other patient who is not having a pneumonia, just because their mindset goes right away to pneumonia. And that's where like Zirr helps you to have like that pulmonary embolism at top of your differential diagnosis too, let's say. So it's just gonna remind the physician or the healthcare provider who is having some sort of anchoring bias or availability bias just based on the patient population that they had over the week or over the day to miss a patient. And I think it's really good. I had to mention this because lots of people hear AI and they think we want to replace the workforce. No, not at all. We just want the workforce to have a more relaxed and meaningful environment to work at.
Yeah. No, I think it's interesting. I've always thought that clinical decision support was coming to the ambient clinical voice space. So I think it's really interesting that you're incorporating that from the get-go. It is such a huge opportunity. Yeah, I've often said that I think ambient clinical voice, these medical AI medical scribes are going to become the interface of the doctor. And so then that has to be the clinical decision support spot if they're not opening the EHR. So it's fascinating. Lee, though, I'm surprised you don't think that an EHR vendor having a neurologist create templates for 3 weeks isn't enough to customize it for. I'm joking, of course. But that's kind of what they did. We have a neurology template base that someone made for 3
Well,
weeks.
believe it or not, each physician has its own. They actually share it with you.
Yeah, it's it was funny. I remember going to an EHR vendor user conference and they said we now support every specialty. And I'm like, well, how do you define support every specialty? And I think the answer was like, yeah, well, a neurologist worked for 3 weeks and tweaked these templates, so now we support that specialty. It's like, no, that's not quite how it works.
Exactly. And a lot of the EHRs, you can create your own template. I mean,
Yeah.
I'm not gonna
They
lie,
done.
I have my own templates in the hospital sometimes that I use.
Sure.
You play with it, but that's something that we had 20 years ago as well. So I think if we want to incorporate what AI is bringing, we have to go one step further. And to emphasize what Arnavaz was saying is that I think it was AMA president last year in an interview was saying, American Medical Association, that, AI would not replace physicians, but physicians who know how to use AI are going to replace the ones who don't know how to use AI. I think that should be the mindset in terms of all these ambient technologies, AI technologies that's out there. And I think with the new generation of the doctors coming and being trained, people are more open to the idea. They don't feel threatened. They see the opportunity of using of the AI in their work and in their practice, and utilize it in a way that's helping them and helping their patients.
It's kind of
I
amazing
mean,
to
change
think.
is not always bad. Change can be actually meaningful.
Exactly.
So it's
Sure.
good not to be resistant to a
Yeah.
meaningful change, in my mind.
Yeah, well, I mean, a new med student may not even know the joy of templates and clicking a zillion times if they go straight to ambient voice. That's interesting. Then they won't know the difference, and they'll be grateful for it.
Right.
So, if people want to go to learn more about you and get a demo, where should they go?
Just Zirr.ai, ZIRR.ai.
Awesome. I'm sure a lot of people are going to want to check it out and try it out, and it's beautiful. They can do that with no credit card required. We love that. So, both of you, I appreciate you taking time out of your busy schedules as you kind of launch Zirr AI, and offer this amazing product. We're excited as much as anyone in the world is about ambient clinical voice and the way it's going to help doctors like you all. So appreciate you taking time to share about your company, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks.
Thank you for having us.